Gastric cancer surgery, also known as gastrectomy, is a procedure to remove all or part of the stomach affected by cancer. The extent of the surgery depends on the stage of the cancer and the overall health of the patient. There are different types of gastric cancer surgery, including total gastrectomy. This surgery involves the removal of the entire stomach, nearby lymph nodes, and sometimes parts of the esophagus, spleen, pancreas, and small intestine. Partial gastrectomy. In this surgery, only the portion of the stomach affected by cancer is removed, along with nearby lymph nodes. Endoscopic resection. This procedure is performed using an endoscope, a flexible tube with a camera and a cutting tool. The endoscope is passed through the mouth and into the stomach to remove small early-stage tumors. Total gastrectomy is a surgical procedure in which the entire stomach is removed. This surgery is usually performed to treat stomach cancer that has not spread to other parts of the body. During the procedure, the surgeon will also remove nearby lymph nodes and sometimes parts of other organs, such as the esophagus, spleen, pancreas, and small intestine. On this surgery, the entire stomach is removed, along with the lymph nodes and any other affected organs. If the esophagus is also removed, the surgeon will create a new pathway for food to pass from the mouth to the small intestine. After the surgery, the patient will need to stay in the hospital for several days to recover. The recovery period may be longer than for other types of gastric surgery, because the stomach plays a critical role in digestion. The patient will need to follow a strict diet and may need to take nutritional supplements to ensure they are getting enough nutrients. Total gastrectomy can have long-term effects on digestion and eating habits. Patients may experience dumping syndrome, which causes nausea, diarrhea, and other symptoms after eating. They may need to eat smaller, more frequent meals and avoid certain foods. Patients will also need to be monitored regularly to ensure the cancer does not return or spread to other parts of the body. During the procedure, the surgeon makes an incision in the abdomen and removes the affected portion of the stomach. The remaining parts of the stomach are then reconnected to the small intestine. There are different types of partial gastrectomy procedures, depending on the specific condition being treated and the extent of the stomach removal. For example, in a subtotal gastrectomy, up to 80% of the stomach may be removed, while in a distal gastrectomy, only the lower part of the stomach is removed. After the surgery, patients may experience some discomfort and will need to follow a special diet to allow the remaining stomach to heal. They may also need to take supplements to make up for any nutrients that are not fully absorbed by the smaller stomach. Endoscopic mucosal resection, or EMR, is a minimally invasive surgical technique used to remove early-stage cancers or precancerous lesions from the lining of the digestive tract. In the case of gastric cancer, EMR can be used to remove tumors that have not yet invaded the deeper layers of the stomach wall. During the EMR procedure, a flexible tube with a camera and specialized instruments is inserted into the stomach through the mouth. The surgeon then uses these instruments to remove the cancerous or precancerous tissue from the stomach lining. The removed tissue is then examined under a microscope to ensure that all cancerous cells have been removed. EMR is often performed as an outpatient procedure and is associated with a shorter recovery time than traditional surgery. However, it is important to note that EMR is only appropriate for early-stage gastric cancer, and more advanced cancers may require more extensive surgery. The prognosis of gastric cancer depends on several factors, including the stage of the cancer, the patient's age and overall health, and the treatment options available. Generally, early detection and treatment can improve the prognosis. It's important to note that survival rates are based on statistics and do not predict individual outcomes. Every person's case is unique, and factors such as overall health and response to treatment can affect the prognosis. Treatment options for gastric cancer may include surgery, chemotherapy, radiation therapy, targeted therapy, and immunotherapy. A combination of treatments may be used depending on the stage of the cancer and the patient's individual needs. Regular follow-up care is essential for gastric cancer survivors to monitor for any signs of recurrence or complications. It's also important to maintain a healthy lifestyle, including a balanced diet and regular exercise, to help improve overall health and potentially reduce the risk of recurrence.